Hi, Jeffrey. My name is Christine. I'm going to be the nurse practitioner. Today I'm going to go ahead and perform your neurological examination by checking all of your cranial nerves, checking out your coordination and your muscle strength and the way you walk and things like that. Do you have any questions for me?
No.
Okay, so I'm going to go ahead and start with your neurological exam by checking your cranial nerves. First, I'm going to go ahead and check your sense of smell. Go ahead and close your eyes and occlude a nostril. And then I'm going to go ahead and put something there. Go ahead. And can you identify that?
Garlic.
Great. And go ahead and occlude the other side. Go ahead.
An onion.
Thank you. So next I'm going to go ahead and check your eyesight, your optic and oculomotor cranial nerve. If an ophthalmoscope was present for me, I would go ahead and check his red reflex, check both of them to see if they're both present. Check the optic disc as well as checking his ocular motor nerve to see if his pupils are equal, round, and reactive to light. Let's see. So, Jeffrey, go ahead and just stare at my nose. Okay, and they become more pinpoint. Great. And also, next is checking for his trochlear and abducens, which is cranial nerves 4 and 6. And then we're going to check the six cardinal views of gaze, and to see if his eyes they can move. So go ahead and follow my finger. Great. And that's checking for his extraocular movement of his eyes, so he's able to follow my fingers without having to move his head. Next is going to be the trigeminal nerve, which is the cranial nerve 5, and and go ahead and tighten your jaw. Okay, and I'm going to go ahead and take this paper clip. There's a sharp end and a dull end. I want you to identify. Go ahead and close your eyes. I want you to identify if I'm touching your face with the dull end or the sharp end, okay?
Mm-hmm. The sharp end. Dull. Dull. Sharp.
Great. Thank you very much. I'm going to go ahead and check his facial cranial nerve. Go ahead and smile, Jeffrey. Okay. I don't think the camera can see my face. Go ahead and smile, Jeff. Great. And go ahead and puff your cheeks. And give me a big frown. Great. Thank you very much. And then go ahead. I'm going to check your hearing. Go ahead and occlude this ear. And I want you to say what I said.
Banana.
Go ahead and to the other side.
Oranges.
Great. And also for cranial nerves 9 and 10, which is the glossopharyngeal and vagus nerve, I want you to go ahead and swallow this cup of water. Great. And I'm going to go ahead and check your tongue. Go ahead and say ah.
Ah.
And that also checks his cranial nerve 12. I'm going to check his spinal accessory muscles. So against resistance, Jeffrey, I want you to shrug your shoulders. Great. And against my hand, go ahead and turn your face towards my hand. And again, towards this hand. Great. Thank you very much. Mm-hmm. And while I have you here, I'm going to go ahead and test your muscle strength. So I'm going to go ask you to spread out your fingers against resistance.
Okay.
Okay, so go ahead. Great, they're go ahead and check your wrist. Go ahead and do a fist for me. And I just want you to move your wrist right. Go ahead against strength. And go ahead and push down. Okay. So go ahead and palms up. And go ahead and try to do. I want you to flex your elbow.
Okay.
Great. And then again, extend your elbows. Great. And with your thighs, Jeff, I want you to go and raise them just like this.
Oh, okay.
Against the strength, my strength. Great. And go ahead with your shin as well. Great. So those are all equal. They don't have. He doesn't show any sign of weakness with his muscle strength. Also, I want to check your coordination while I have you seated. I'm going to go ahead and use the paper clip again, and I want you to check if it's dull or sharp.
Okay.
I'm going to go ahead and do your arms and maybe your legs. Can you pull up at least one? There you go. So go ahead and close your eyes, Jeff.
Sharpen. Dull. Sharp. Sharp. Dull.
Great, and his senses are pretty precise. So go ahead and stand up, Jeffrey. And we were gonna do coordination testing his coordination. Go ahead with your palm up. Now I want you to close your eyes. And while closing his eyes, he should be able to remain upright. So Jeff, go ahead and open your eyes. I'm gonna go ahead and put some resistance on your arms, but try to keep still, okay?
Okay.
And this is great. And that's gonna be the pronator drift, where the patient is able to put his both his hands up even with my resistance. Go ahead and sit down, Jeffrey. I'm gonna go ahead and check your deep tendon reflexes. I'm gonna go ahead and pretend this is a hammer. So I'm gonna go ahead and check his brachial radialis, and his thumb should flex. Great. Okay, and that's gonna be C6. I'm gonna go ahead and check his bicep tendon, and his biceps should also flex with my notion, and that's gonna be dermatome 5 and 6. Okay, great. And also with his triceps, it's gonna be hard for him to relax. I'm gonna go ahead and check your triceps. Just relax like this. And you should have some slight movement right here. Okay. And that's going to be C7 for the dermatome. For the patella, it's going to be L1 through L4. We're going to go ahead and isolate the patella, and we should, if this was a higher chair, let me just move this. If this was a higher chair, he should be able to jerk the knee. Okay, and then we're gonna go ahead and I'm gonna lower this camera and check for the plantar flexion, in which I stroke. I'm sorry. There you go. And then there you go, and he should be flexing his toes. And then we're going to go ahead and check the Achilles, just right here. And I should be able to strike that. There you go. Great. And then one last thing for his gait. Jeff, can you go ahead and walk, go ahead and stand up and walk a couple of steps forward. Great. And then I want you to walk in a straight line. And then going back, I want you to walk with your heels. And then going back, I want you to walk with your toes. Great. Thank you very much.
Mhm.